So this morning, we are putting out some salt licks for the pastures. We try to put these out because we have some awesome donors donate these for the horses, and it can get a little bit boring whenever they're standing there for hours in the day. So we put these out. Also, salt has a lot of benefits in horses. I try to put them out for everybody, and then once I've eaten them down, I put them back out. So they regularly have salt. Hello, Dino. All right, y'all. People have donated these, so y'all eat these. Don't be wasteful now. I gotta put them down low. Y'all are so cute. Is that so good? These things are sticky. Do you love it? Oh, wow. Dino does love some salt. Sorry. All right, get to eating it, bud. Look, you want me to taste it? It's good. All right, next is George. Admiral! George, come, Admiral. I got in trouble for calling him George. Admiral! So for y'all that don't know, we're here with Admiral George. He's a resident. He got adopted out a few years back, and then his adopter was responsible and decided to, I don't know what the circumstance was, but it was a pure surrender. She had good intentions for him. And we said, we will take him. And he's gained 45 pounds in the past 2 weeks. You gonna try it? Is that good? I tried it, it's good. Admiral approved. So we're going to Kiona and Hiego's pen, and they love the Jolly Balls that people have donated. They fight over them, so I have to put 2 out there because I like kids. And then they love all those little stall snacks. So they will be mad if we don't give them some salt. So we ran into Cody while we're putting salt out, and I guess she needs help running these horses.
I don't know what I need help with today, but nothing is on my team. Everything is fighting against me, and I'm just struggling.
It's just one of those Mondays.
It's just one of them Mondays. The horses are giving me a run for my money. So we're gonna go ahead and get Zephyr down and get her ready for her adoption appointment. And hopefully everything goes well.
Wait, so Zephyr?
Zephyr and Bonita, but we are really pushing for Zephyr because she made an awesome comeback. When she came to us, she was skin and bones, and she was in quarantine for like 60 days, like for a while. And she's down here and she's thriving and surviving, so we're gonna get her prettied up for her appointment.
Come on, Cydney.
I thought I was standing right here.
Well, no, Jennifer's right there.
This salt block's kind of weighing me down.
My extra arm is always on point and makes them run.
Anything helps. Like stuff as small as a salt block is what, like we appreciate that stuff. Like we put it out for the horses. We enjoy our donors. We have great donors. Also, tomorrow, the pizza's free. Did you hear?
I did.
That keeps us going on buy-out days. It's really hard for us to kind of put emotions aside, and we do appreciate the free pizza.
Just gonna run away.
Okay, so what are you up to, Hallie?
So I am feeding these little bottle baby kittens that we got about 2 weeks ago.
They're doing really well, and when they first came in, I was actually the first one to volunteer to take them home and bottle feed them because bottle babies have to be fed every 2 hours around the clock, so it's a lot of work. But when I was in high school, I fostered a lot of little kittens, so I was like, I would love to do that. So I've been fostering these little babies, and they're doing really well, and right now we're just feeding them some of their kitten formula, and they're doing really well with it. And then yesterday we got these adorable little fluffy babies, and they're a little older. They're about like 4 or 5 weeks old, and I actually decided to adopt one of them. So I named her Raven, and I brought her home last night, got her all set up. I got her cat tree and a bed and everything, so she's doing really well. And I always wanted a black fluffy cat, so she's perfect. Just been working with these little kitties, and they're growing healthy and strong and doing well.
Good girl. So yummy.
Girl. Oh yeah. She's got some drainage. We gotta get that cleaned up. Good girl. This little Mustang mare's name is Misty. So Misty came to us as a transfer from another organization. She already had this pretty significant scar on her head. She's got a big scar kind of around her neck. So she's had some indications that she's had some injuries before. Cody and Peyton have done a great job working with her. Unfortunately, almost 2 weeks ago, she made some poor life choices and tried to escape out of our chute system and impaled her right shoulder pretty significantly on a part of the gate. But she is at a point where I either have to change course of treatment or she might get to go outside, and she won't let me examine and palpate this without sedation. Hi, big girl, remember me? I stabbed you a few times. Okay, all done. Now we wait. My favorite game. So I tried to sedate her intravenously. She was not into that. Understandably, she's had a lot happen. So I had to give her a sedative in the muscle, which takes a little bit more time to kick in. So we're gonna wait until she's sleepy, and then hopefully she will let me kind of poke and prod that wound a little bit, and we'll kind of take things from there. I'd really love to get her into the chute. This is some progress. Good girl. Good girl. It's fair. Like, we might be able to push her a couple inches, but we're not going to be successful pushing her all the way in. You're very difficult. Can you take one more step forward? Good girl. Good job. One tiny step. Can you do it again? This is a great example of how I'm always wrong when people are like, how long is it going to take? And I'm like, 10 minutes. And then I think I'm just going for it because I have access right here. Like, let's try. And I just figured this would be easier while she can't really try to kill me. I'm just numbing it. Puncture wounds, you almost never want to close because they're deep and dirty. Honestly, guys, this is working great.
It is, ain't it?
I'm not sad. So the good news is I don't actually think there's a big abscess tract. The bad news is there's still a pretty deep hole, but as long as we keep flies out of it, I feel really positive about how this looks today.
Ew. I was at the
It's beta.
blood coming back out.
You can see the parameters of this pocket. It's there. And that's another gas tract. And what is that bright hyperechoic? That should be surface of bone. Really, if her bone's not broken and this is gonna heal up, she's fine. She's gonna have major muscle scarring and it'll work its way out. I love this stuff. This is called Equade. I'm impressed. Oh, look at it. Look at it worming its way back out. Isn't that beautiful? It's so beautiful. The body is amazing.
She was about at the point where I had to decide today whether she could get turned out or whether she needed to stay in our hospital. And I'm very happy that we didn't find a big pocket of infection, so that was great. Our ultrasound was consistent with what I would expect for a wound at this stage. She has some pretty severe abnormalities in that muscle, but what happened was a piece of metal went about 8 inches into her shoulder, and then she tried to move forwards and back several times. So you can picture the level of tissue trauma that occurred when that happened. So now we're just gonna wait until she's a little bit more awake, and then we'll put her back in her stall.
So it's a beautiful morning. It was like 50 degrees when I left the house, and so we're really excited about this weather. Also, we're even more excited because we have Bonita and Zephyr in the round pen, and Cody has been working with them this morning, getting them all pretty because they have an adoption appointment. The potential adopter, her name is Haley, and she's very excited to meet these two. So we're just as excited, and y'all follow along. So that's Cody. She's our horse trainer here. Hi. You're okay, baby girl. We rescued her from the slaughter pipeline.
Okay.
And when she came to us, she was a bag of bones. And we fed her good for 2 months, and I think she's gonna be an easy keeper because she has progressed very fast and very well with us.
Yeah.
Up in quarantine, we have a chute system, and she wasn't halter or trained at the time. Cody did all that in a matter of like a week, maybe. She's very smart, and she never had her moment, really. She just takes time. When she was up in quarantine, when she didn't have any weight, I gave her Senior Triple Crown. Okay. And she's been on Triple Crown feed, and she gets some B12 vitamins, and then I throw in some treats. So over here is Bonita. She is a Mustang. She came from Florida.
And she came from, was it like wildlife rescue?
It was a wild horse rescue in Florida. And if you want to lead them around, fill them out, that's whatever you want to do. She watches everybody.
You're saying that.
Mm-hmm.
You can't get nothing about her.
She's usually not patient at all, and she's just raring to go. She talks to us. We ask her questions, and she nods her head. Cody will say, "Do you love me?" She nods her head.
Sometimes she tells me no.
I said, "She's lying." I've been trying to give her a hug for a week because I try and hug everything. And then finally last week, she did let me give her a hug over there, so.
I make them kiss me.
Yep.
I hate that.
We aggravate them so bad, but it's good for them because that's exactly what people are going to do when they bring them home is love all over them, which is what we want.
You gotta put a little bit more pressure. Grab it and put a little bit more pressure.
There you go. So a lot of times we just turn around and walk. And like I said, she's just been started this month on a halter. So and then if they don't want to go, we just turn them to the side and have them turn. And that flexes them to turn. Like if she stubs up right here, well, she's not gonna do it. Good girl, that's a good girl. Even when she was unhandled, she was very respectful of personal space. Like she's never, like we get some in that are unhandled and once they get trained, they do better and they just kind of run right through you. She's been so respectful of everybody. You want another one?
She said, give me the whole bucket, She's gonna
give it to you.
Matter of fact, give me that whole bucket.
She would.
With my hand? You'll bless your hair.
She's gonna give you one more because you're gonna have a sugar coma here. She's like, that can't be all the treats. This is a ripoff. You're so cute.
She's so precious.
She is.
She appreciates it, I'm sure.
Are you so tired? But if you need time to think about it, that's up to you. If you want to load her up now, we'll load her up now. Yeah. I'm just saying, you're approved and you're going to be a great home for Zephyr or Bonita, whoever you decide. But you going to take her home? Yeah. Yay. 1, 2, 3. Zephyr. Everyone's gonna be so happy. Woo! We love updates too. So the email that you contacted me, if you get home and you have some pictures, we love to see updates.
Oh yeah, I'll take some.
Bye, Zephyr.
Bye, good luck.
Thank you.
So as we guessed, Zephyr got a home today, and we are just over the moon for her. She's gonna have a great mama, a great home. She has friends at home as well, so she's not gonna be by herself. I just knew Zephyr would get adopted because she's beautiful, and I already had her paperwork laid out and everything, so I guess I kind of manifested that in a way, but we're really excited. So this is what we like to see, and this makes my job worth all the hard stuff that we see and all that. It just makes it all worth it.
Today is buyout day. So Dr. Lydia and I loaded everything up. We're gonna head up to unload it all and get everything set up so that way when the horses come, we are ready to tackle whatever comes off that trailer.
This is the calm before the storm. Our team is up, ready in quarantine, waiting for horses to arrive. They should be here soon. I'm an optimist, so I'm always really torn. These are really hard days. If you've watched our show, we get horses that were intended for slaughter. So we have a new hauler bringing us horses today. We have 13 horses, 12 horses and 1 pony, I think, although we kind of never know what's gonna show up, coming from Ohio. And then we have another person who is bringing, I don't know how many, possibly donkeys and mules. And then we have a third person who also might come. This all depends on funding. So if it seems like I don't know what I'm talking about, we really don't know. We save as many horses as we possibly can, and our fundraising team tells us how many horses we can save per month. So we're just poised and ready with our stuff, and we kind of never know what we're gonna get. I always worry about the horses that are down in the trailer, so we're prepared to try to help them get up and not get injured on their way off. But this is a tough day for our staff. I have to kind of mentally prepare my mind and heart. Oh, watch out. Fractured carpus.
Oh my God. Oh, you're so cute.
Okay, looks like found her, so. Oh, honey.
Yeah.
Oh, we look blind. Here. Hi, sweet thing. Can you see it all? Good job. Easy. Easy. Step down. Easy. Good job. Cydney, are we visual on the right? Do we look visual on this side? Yeah, okay, we're partially visual. Nicole, the horse that I just gave this to is blind at least in the left eye. Looks like maybe both eyes. It looks like maybe a standee. It's the one Cydney's working on. This horse has some pelvic instability. Cutaneous. Yeah. That's CPL.
Who's that?
chronic progressive lymphadenopathy. What's going on with this eye? Oh, this eye needs to come out, stat. Let's get some,
Here's Vanamine.
do you have more Vanamine? Okay. Hi, I didn't get a baseline heart rate on this guy. Hi, you okay? Easy. Little poke. Easy. Good job. Okay, resting heart rate is 62. Maybe a thoroughbred. Do you have a lip tattoo? It's like we're about 19. Can I look under your lip? No tattoo. It looks like a fractured carpus or fetlock to me. So I would love radiographs. Okay. But let's give it just like 2 or 3 minutes to let the Banamine kick in before we ask. Okay. This mare we pulled right away. She appears to have a fracture or a dislocation of this left front. Her resting heart rate is 62. Upper end of normal for horses is in the upper 30s. So we got some pain medication on board right away. I'm gonna do a physical exam while we let those pain medications kick in, and we're gonna take some x-rays. She looks like she's about 19 years old. See that? Okay, okay. So that's a pretty significant back pain on palpation. Okay, good girl. All right.
Heart nice.
Yeah. She has reduced GI sounds in both of her upper quadrants. She's very reactive to palpation on her back, and she's got a lot of scarring. So she has some back pain, like even just very lightly touching. She doesn't have active digital pulses, but she does have some effusion in the support limb. So horses carry 60% of their weight in their front legs, and this mare is holding maybe 10% over there, about 90% over here. So this is why horses with a fractured leg have a really difficult time recovering, is that the other 3 legs just don't compensate well. Had a little bit of patient movement. Yikes. Look at all of this.
Even that looks like weirdly
This
detached.
looks detached. Yeah, let's take the orthogonal. Frequently what we see with these guys is a single lesion, like there was a fracture. In this mare's case, I think there was a severe soft tissue injury that wasn't addressed, and she's got severe osteoarthritis that's proliferating, so she has crunchy bits of bones where they shouldn't be, and the soft tissue structures that she does have, yikes, she's got some back lesions. All of the irregularity here, all of these divots and chunks out of this bone should not be there. This irregularity, all of the areas where you see kind of a spongy, moth-eaten appearance is abnormal and indicates severe advanced disease. So what's really heartbreaking is instead of that joint just having one fracture that healed that way, she has functional joint space and she just has crunchy bone grinding on bone, and it goes pretty far down in this foot. So you can see all of the osteoarthritis on the sides as well. So this lesion is right where she was very, very reactive to palpation. And you can see the caps of these vertebrae. This is a normal finding in horses, but this appearance right here where these vertebrae are touching each other and kind of lytic from rubbing each other is not normal. And those are kind of that one's not diagnostic, the major findings. This poor girl. And it looks very old. She's got a mild kissing spine lesion in her lumbar spine. And you can see in her face, see how her face is still really tense right here. Mm-hmm. So sometimes chronic pain, horses, this is better than it was. But this feels like it's been here for a long time. And you can see the contracture of these tendons right here. So these bones aren't lined up the way they should be, and I suspect that she can't even move it. She is unable to straighten this leg. She just can't do it. I'm not gonna ask you again, man, you're okay. Soft tissue generally heals in about 8 weeks. So even a severe soft tissue injury, if you support the horse through it with 2 months of appropriate post-injury care, you can end up with a very normal functional limb. And again, I'm making assumptions based on what I have seen, but I would call this horse a severe proliferative osteoarthritis, secondary to a soft tissue injury, not a primary bony fracture. But it's so severe and it went on for so long that this horse can't straighten her leg because the bony proliferation and the arthritis is so bad in this area that it's just little crunchy bits of bone that are touching other crunchy bits of bone. So the pain was so severe that she avoided moving the leg, and now she cannot move the leg. You're a good girl. I know, I'm sorry.
But you said you was on that bus to do it. You said sorry.
So let's get you some pain meds.
What did she say that this little pony's heart rate is?
70. So that's very fast for a horse, and so she's gonna get some pain meds on board and make this little guy comfortable. I think it's a guy, maybe it's a girl. But anyways, either way, it's gonna be comfortable. Is that snot on its back?
Okay, sweet friend. How are you for pokes? Hi. Can we try to keep these front feet on the rubber?
Yes.
Wonderful. I know you're not completely in control. I gotta poke you, I know. Let me help you feel better, okay? Very good. I'm gonna try to disconnect and just pull blood so I don't have to poke again. Yeah. There we go. I know. I just don't want to have to poke you again. Good job, tiny thing. So we just gave flunixin meglumine or banamine. It's an anti-inflammatory pain medication. I know your feet hurt, I'm sorry. So this little mini mare is in her upper 20s. Her resting heart rate was in the 70s, and you can tell by the way she's walking, she's painful, she's trying to get weight off of those front feet, and this is a pretty classic. From the outside, it looks like this is a chronic laminitis case. So we're gonna take some foot radiographs. She did get pain medication right away, and it's just really difficult to tell from the outside, and we don't ever wanna make a decision without those diagnostics. So we are gonna get some foot rads and take it from there. If you're watching this, that blood is just because I didn't wanna poke her twice and I disconnected the needle. So her foot is not bleeding, but we're gonna take some foot radiographs. She has bilateral cataracts, so that's another indication of advanced stage. And she's very, very thin and a little bit dehydrated. So we're gonna get those x-rays. She's a very good girl. Thank you for donating German horse cookies. They're a crowd favorite. Here you go, Cydney. Okay, I'm gonna go put lead on.
So Angela, I was coming down the hill and I seen FedEx.
I heard FedEx.
So the first thing I seen was Cheryl's. And so I said, let me check the label. And the label said, a treat for the hardworking staff. Enjoy, Cindy.
I have a knife. I know you don't like knives.
Okay, I'll let you do it.
It's already kind of, the tape is a little
wonky, but I'm excited.
I mean, we all know I need another cookie. They're so good.
Yes.
They're so good.
I remember we just had a thing about cookies earlier.
We did have a thing about cookies earlier.
We were trying to figure out who stole the cookie.
We were trying to figure out who stole the cookie.
Yes.
And the cookie wasn't stolen.
This is my cookie trap. Wait a minute. Never mind.
That's so funny. I love Cydney's face when she realized. Poor Cydney. That girl loves her food.
Yes, she does.
And she did have somebody take her food. They were bringing it, and then they drove off with her order. Poor girl, she's traumatized. Look at this. They're all the same. Crunchy chocolate chip cookies, but by the bag.
By the bag.
And there are bags and bags of these cookies.
Oh my goodness.
Look at all these bags of cookies. But see, this one is popped open, so it's only fair
that you test try.
Yeah, I test it, right?
Yeah.
Are they just crunchy or are they a little soft in the middle?
They're soft in the middle, but they're crunchy on the outside. I love it.
So these are fine.
These are popping.
These are fine.
Oh yeah, she's crunchy. Crunchy.
Oh my goodness, there are 4 servings per bag. I'm sorry, I didn't mean to ruin it for you. I was just excited.
You just stole the joy.
I'm sorry, I was
eating
excited.
this
I was like,
cookie.
wow, it's only 120 calories. You know, we could just hide these in here and not share them with anybody. But Micah knows and he's a snitch. I think Micah would tell on us.
That's so true. I mean, he has the camera. He would tell us.
He does have a camera. Plus,
Cindy, we want to thank you. But you don't know. Woo!
It's been a long week and it's only Tuesday. But we are so thankful, Cindy. Thank you.
We are. Thank you.
So thoughtful.
Yeah, we might actually be able to. You're so sweet.
Yeah, are you trying to do both? Or?
I was just thinking about it, but I think I'm just gonna go for the one that's up. Okay, you can put it down. Oh, that medial lateral imbalance. Can we try for this other one? It seems like this one hurts more, so it might be hard for her. Hi, I know I had the cookies. You're a good girl. You're a super good girl. These guys are always so heartbreaking. This little mare is so sweet. I think it's probably safe to say that she's been dealing with chronic pain for years and years. This is end-stage laminitis, like truly end-stage. She has active pulses in her feet. And what we want to see normally is that this bone, the coffin bone, the face of that bone is a smooth parallel line to the hoof wall itself. And you can see in her case, not only has it rotated, it's also sunk, and she's got a severe slipper toe right here, and this is true on both front feet. So I suspect if it was just one foot, she wouldn't be able to walk, but she's just severely lame on both of those front feet. Again, founder is usually manageable, especially if you catch it when it's acute. You can work with your farrier. It's often related to metabolic disease, and if you're watching this and your horse has had a founder episode, it's survivable. It's not easy, it's not inexpensive, but it is something that we can do, and we can manage horses with this condition as long as they have appropriate care for many years. And in this little girl's case, she's so far gone that her bones are almost fully resorbed in her feet. And there's nothing that we can do at this point to get her comfortable or keep her comfortable. And so we will provide her with many cookies and good pain medications and let her go. It's just always hard to look at these cases and know that no one advocated for this horse earlier in her life. Oh my goodness. Look at you, love. Hi. Do you maybe need some drugs? Well, I'm 5'11". Her withers are about as high as my head. So if a hand is 4 inches and she's 6 feet at the withers, so this mare there's 3 different ways you can say it. You can say chronic progressive lymphadenitis, you can say chronic progressive lymphadenopathy, or you can say chronic progressive lymphitis. All of them are descriptive of the same condition. Some type of inciting cause. It could be UV damage. It could be chronic wetness. Usually it involves a secondary bacterial infection of the skin that causes a lymphatic reaction. So your lymphatic system is involved in draining stuff. So this is a condition we see in certain breeds way more often than other breeds. I've never seen this in a non-draft horse, although it can happen. And CPL is a chronic progressive incurable condition. To date, There are no successful treatments for this condition. The treatments that we have are aimed at preventing progression. So if you have a draft horse and your vet comes out and you go, you know, my horse's foot has just been a little swollen, you know, down here by the feathers, and I ran it through a course of antibiotics and it just looks a little fat here. You can prevent this condition from getting to this stage with appropriate management. You can do compression bandages, you can treat the primary source. But once you get to the stage where a leg is cold to the touch and lumpy and firm, the damage is permanent. So there's nothing that we can do to make this leg smaller than it currently is. The other really heartbreaking thing in the cases of this disease that we see at Horse Plus are these chronic draining tracts. So this is not, I stabbed my leg on something and I have a wound. This is, I have so much chronic infection trapped in my lymphatic system that I'm just chronically oozing and dripping. And some of these horses will literally drip lymphatic fluid. In my opinion, based on smell, that's also a bacterial infection. This can also be a neoplastic process, so that means cancer. So this can be a combination of all three of those things: inflammatory, cancerous, and/or bacterial. So if your horse gets this diagnosis early, great. You can manage them with this condition to try to prevent additional disease. Once they get to this stage, it is game over. There's nothing that we can do for this mare to get her leg more comfortable and to get her to a point where it would be fair to ask her to continue living, which is just absolutely heartbreaking. I am so thankful that she didn't end up as someone's next meal. I'm thankful that we could give her pain medications. I'm thankful that she ended up here at Horse Plus. But it is heartbreaking. I actually haven't looked at her teeth, so I don't know how old she is. She doesn't look that old to me. This looks like her only problem. Other than this, her physical exam has been normal, and that just is really heartbreaking.
All right, Amber, so what are you up to this morning?
Well, we came in this morning with a surprise in the feed room. Apparently, over the weekend, one of our shelves broke. So we get to clean all this up today.
That
Yay.
does not look fun, but
It'll be great.
It's great. It's fun.
It's fun?
Yeah. I can feel the gray hair growing.
Yeah, so this shelf is all broken, and so if any of you guys watching are like, I really want to help out Horse Plus, we could really, really use a shelf to put all this stuff that fell off on. So that would be very much appreciated. We love you guys so much, and that would be amazing.
Okay, here we go. Okay, the last time we talked to you, it was about 9:30 a.m. and it is officially 20 minutes till 3 and we're finally done. So, finished product right here.
Ta-da!
It took forever. It definitely should not fall over. They're shorter now, so they're more sturdy, and we've got most of the heavy stuff lined up at the bottom. So
We organize everything by like the specific brand and whatever. So like we have the senior weight accelerator over there, and then like goat treats and horse treats over here. So it's all organized. So we come in here wanting to find something, then we can find it pretty easily now. So
yay!
It's good.
See how his back legs are just crossing over each other over and over again. Oh, he has no teeth left.
Ugh.
Like there's just not teeth in there. So let's microchip him. Vaccines, dewormer. You guys want to see this? So this guy is young. He's not very old at all. I aged him at 6. And you can see on the lateral side of his left hind leg, kind of in the outside, he's got a big bump. And what we see on X-ray is that there is actually a bony proliferation inside that area. So you can see right here, but he's comfortable. His heart rate is normal. He sounded a walk And that's really what we care about, right, is whether or not these guys can be comfortable. So I didn't have to give him any pain medication today. We're gonna send this to our radiologist, Dr. Marina, and have her kind of stage it. And he's gonna get some vaccines and some fly control and a microchip, and then he's gonna get turned out to decompress. Good girl. I'm gonna palpate under her tail one more time, but I'm gonna do it from this side. She seems really sensitive around that scrape that she got. You need a bath. Good girl. Oh man, you guys wanna see this over here? So she's got a pretty sizable mass associated with her rectum right here. Do you see this mass right here? And then she's got a bunch more masses underneath her tail. So obviously I can't put my pathology eyeballs on and say 100%, but 99% of the time, something like that, that a gray horse has a bunch of tumors. It's usually melanoma, which is a malignant type of cancer. And what's tough is when I see these in private practice, usually they show up as like a little pea-sized, like pencil eraser-sized bump underneath the tail. And the owner will go, well, that's not that big of a deal. But what we know based on these cases over time is that there are other masses often inside the body that we can't see outside the body. So it's not just, you know, some bumps under your tail aren't going to bother you, but we know what cancer does to our bodies. So,
Pretty positive without even using the microscope. So yeah, you get like that really dark black color. So like this isn't blood. Because it should, like, if it was just blood, it'd be like a red color and then we would look under it. So this is actually the worst I've seen with poking some of these masses, so.
Today, I'm the primary horse handler, so I'll go out, grab them. Usually Nicole or Dr. Lydia will say this one's next critical one that you need to get. And then I bring them in and hold them for x-rays so they can examine them. I'll assist them if they need be. And she's about to get some wormer. She's not gonna like it. Ma'am?
Yes.
Oh, you spit it out. She got most of it.
Okay.
But this is Quest. So today, mostly every mile, I just assist and go where I'm needed.
Very sweet. Yeah. Okay, so I'm just gonna start with a full physical. You got another eye to take out on Thursday anyway. Maybe we should take yours out too. Okay. Yeah, you're doing good. You can keep chewing. Okay. We look like we're maybe 22, 23. This outer incisor has a groove called Galvani's groove. And to be really clear, Galvani's groove by itself is not an accurate way to age horses. There are certain ages where you can be 100% sure. So under 2, 3, 4, 5, and 7, 10, 15, 20, you usually can get pretty close with aging based on cups and stars, which is the wear pattern of those incisors, and now Galvani's groove. But confusingly, because horses' teeth constantly grow, if they have an abnormal wear pattern from a behavior like cribbing, or they have really inconsistent feed, you got someone checking you out, they can wear abnormally, and then that affects our ability to accurately age them. And pretty much over 20, it's anybody's guess. So the older a horse gets, the less accurate it is to age them by their teeth, I feel like. But I primarily am looking at Galvani's groove. Normal heart sounds go lub-dub. This horse's heart goes duh-duh, duh, duh-duh, duh, duh-duh, duh. So we have 2 additional heart sounds with a pretty significant swoosh. Cardiology gets very complicated very quickly. In older horses, the most common thing that I've seen here at Horse Plus is valvular insufficiency. So what that means is the valves in a heart are designed so that blood, do you hear it? Mm-hmm. So that blood only passes in one direction. And when those valves get old or tired, and in some cases in young horses it can be congenital, they don't close as crisply. And so the swoosh that you hear often is the sound of blood flowing back into the heart where it shouldn't be. So anytime I hear a heart murmur of 3 or higher, I want to do a cardiac ultrasound, because some murmurs can be benign and some can be very severe. We would not ever want to adopt a horse out from Horse Plus and have it have a cardiac event and pass very quickly. But without doing a cardiac ultrasound, I can't confidently characterize that murmur. So we're going to put her down for that. These are not the most diagnostic radiographs. I'm looking for evidence that the 2 sides of the occlusal surfaces are wearing unevenly. They should be a nice smooth line. I'm also looking for abnormal spaces between teeth, or like this tooth could be a fracture or could just be abnormal wear. So obviously there's movement in this x-ray, so I can't really see this is fully diagnostic, but I can say this tooth right here is pointier than we want. We've got spaces between this tooth and a space here. Those are called diastema or diastemata. So sometimes in older horses, if the tooth is stable and you don't have gum disease, no big deal. And sometimes that causes chronic pain and we have food pack up in there and we get gum infections. So after this, the next step would be to sedate her, put the dental speculum on, put a headlamp on, get our hands in there and feel those. So she needs sedated oral exam. Yeah. She's cleared to go out in a quarantine pasture. We're going to look at her sooner than later, but she's good for today.
So today we're here with Bonnie. I dropped her treat, but Bonnie is one of our sweet little pigs we have, and we're gonna feed her some treats and interact with her today. She's also available for adoption, so y'all come meet Bonnie.
Let's go see Bonnie.
Hi, Bonnie. She answers to Bon Bon, and she is the sweetest girl. Hi. You the sweetest girl. You love a treat? You're so sweet. Bonnie loves attention. She's a pig, but she acts like a dog. So for someone that wants a yard pig or just a pet, she's also been house trained. If anyone's interested in that, I bottle fed a piglet for the longest at my house. And when it was really little, that pigs can learn to use a litter box. They're very smart. Bonnie would be perfect around a family of kids, adults. She's not a loud pig. She doesn't really scream a lot unless she's about to get fed. She's just a good girl, and she would make anyone a great pet. She loves her belly rubbed. No, you want your food? Peppa's also up for adoption. Peppa is not as outgoing as Bonnie, but super cute and a very sweet pig. Can let me pet you? Okay.
And she came in with Bonnie, right?
Yes, Peppa came in with Bonnie. They were on the same farm together. So, I mean, if you adopt Bonnie, Peppa is going to be sad and going to want to go. Ain't that right? Peppa's always standing at the door, patiently waiting. Bonnie is like trying to rip the bowl out of my hand. But it's all in which one you prefer. If you want a pig that's kind of standoffish but is sweet and will stick around. If you want a pig that'll crawl in your lap, Bonnie's your pig. Very sweet babies though. Ain't that right, Peppa?
The The response to light happens at the back of the eye. So there's the anterior chamber and the posterior chamber. The menace response is primarily is your primary vision response, but you can have a blind eye still have a pupillary light response, if that makes sense. She's very well behaved. She seems to be pretty well adjusted to being blind. I think she went blind recently. She's completely blind. So this cute little mare, I aged at 10. She is super well behaved and sweet. She's completely blind in both eyes. Totally guessing, but as far as I can tell, it looks like she had chronic anterior uveitis. I think they call it moon blindness. I think that's the layman's term. So that went on long enough and untreated that she lost sight in both of her eyes. She's very sweet and very beautiful. And she seems to be pretty well adjusted to being blind. So before she gets adopted out, she will need to have both of her eyes removed. But for today, she's very stable, and she got some vaccines, some dewormer, and some fly stuff. And she's gonna get turned out. I think we should try to find her a sweet buddy. Perfect. She's gonna be eye buddies with, we're gonna have one functional eyeball, 2 horses situation. So that's a perfect buddy for her. I think that's great. Just finished looking at the last horse. We got 13 horses today from someone who's never brought us horses before. They came from a slaughter auction in Ohio. We had to make some really tough calls. We still have 5 of the 13 horses. 2 of them need surgery relatively urgently, so we're bringing those 2 down to our hospital, and the other 3 are gonna get turned out. And if you're watching this and you wanna know more details, we put out a debriefing video. That's just me sitting and talking, so it's really boring, but where we talk through blood work findings, sometimes results of culture, what our radiologist saw in the x-rays, and things like that. So if you wanna know details of the horses that we looked at today and reasoning behind the calls that we made, we're full disclosure about that kind of stuff. So we're hopeful for these guys that we have, and they're about to get to go outside or into the hospital.
Sunlight dances on the balcony as I wait for thee to come home. I fumble my words, yeah, my mind's a mess when you're in that. Glad you're